The desperate hours one hospital's fight to save a city on the pandemic's front lines tells the story of how workers in the New York Presbyterian hospital system fought to save lives and the huge obstacles they face. So Marie Brenner got unprecedented access inside those hospitals, and she is here with us now to talk about her book and what she experienced. I'm really glad that you are joining us today. And people need to know that this was sort of in the early days of the pandemic. So there was so much we did not know about COVID. And there was a lot of spitballing, like, don't worry, you don't need a mask, and just stuff that sounds crazy now.
Yeah.
So you had incredible access. And I was saying to Vlad that a lot of our conversation about the ways in which the ball was dropped has to do with, the federal government or the CDC. But what I thought was interesting about what you write about is also, the mistakes that were made within hospitals when it came to executives who were, angry when doctors and nurses spoke out about the dangers that they were facing. Executives saying, don't worry, you don't need a mask, because they were running out of masks. So they said, don't worry, you don't. And sort of the concern when it comes to the corporations that run these hospitals, the concern that they were having about just how the hospital system was perceived over and above the health and safety of the people who were working for them.
Well, it was an extraordinary moment in New York. You have to think of it almost as if it was a wartime story, the Battle of New York. And it really unfolded like a three-act play where a rocket hit the New York City, really with more intensity than it hit almost anywhere in America, and it hit in New York first. And so you had all kinds of reactions inside the hospital. First, you had, what is this? We are confronting a medical mystery. How do we do this? There is no medication to treat this. What are they doing in Europe? And you have all kinds of people within the hospital system who are really mission driven. Their mission in life is to make people better, is to try to figure out how to make this better. And New York Presbyterian is the Mount Olympus of healthcare systems in America. It's the #1 rated system in America. You have Nobel Prize winners in this system. You have two of the greatest academic institutions, medical institutions in the world, Columbia and Cornell. Their medical schools are part of the system. So imagine you have these experts who are completely confounded, and you have all through, and it's a 10-hospital system. So you're all in every borough. You are in Brooklyn. It is a story of New York City. You are in Queens. You are in Lower Manhattan. You have in this theater of the hospital every ethnicity, every class, every caste. And they have to figure out, it's almost like it unfolds like a play in the first few weeks, as you say. There's just utter chaos. And the doctors who have really been studying this thing are now confronted with, what do we do for these patients? I think for me that was so profound. There was so much of it. I have to say it's been the greatest reporting experience of my life, to have this masterclass of humanity, to see how in a crisis there are those who rise to a kind of valor that, they never, you think of this almost like the French resistance. Who are the people who are on the front lines who are really saving New York? I interviewed, about 200 people within the system through every borough. I have never loved New York more than after the 2 years of being out on these reporting front lines. I mean, there were housekeepers who were working triple shifts who would arrive at the hospital at dawn, who had rituals before they would go into the COVID rooms. You had a respiratory therapist in Brooklyn who had arrived in America as a 15-year-old and was given $100 and put in a homeless hotel, who wound up inventing a kind of vacuum cleaner for the face in Brooklyn, becoming one of the experts on ventilators in our country. You had so many stories. You had a doctor in one ICU in New York City who had grown up in a barrio in Columbia, who wound up going outside his swim lane and coming up with a clamp that could save a patient's life who had been on a ventilator. And all of these stories were there to unfold. And what was so interesting, the head of the hospital system, although I agree with you, there were all kinds of mistakes made. And you can say, why weren't they paying attention to this study from South Korea and that study from China and this study? But the fact is, these were people confronting a battle, like the Battle of Britain. You know, I just would think of my father's stories about being in the war in America and how this greatest generation came together. And you had that again. And so what you had were, how do we get around, how do we get around the hospital's regulations? The head of the hospital is an extraordinary CEO who is an amateur historian. And he knew within the first few weeks of the hospital, as he was hit so hard and in lockdown, that they were living history. And he made a decision to allow a reporter to come in right after the first surge ebbed, and really tell the story and document it. And there were those in the hospital who were not in favor of this because, as you know, running a $9 billion healthcare system, there's so many regulations. He was confronting so many problems with the state regulations that were changing by the hour. Obviously, no doctor has ever trained in a medical school to have a complete failure of the federal leadership, to have an administration that was anti-science. Here you are, doctors digest data. They are studying journal after journal, study after study, and it is their mission to, for a patient, translate what is in the data as something that they can understand. Suddenly, these doctors who have had, in the most case, the most extraordinary training that a doctor can have, are suddenly having to confront how to deal with conspiracy theories, things that go against science, the idea of, people's crazy cure thoughts that they may have gotten from an aunt in Topeka, or, this echo chamber. And so for me, I just felt like this was a drama of personalities. And, as we know yesterday from watching Cassidy Hutchinson testify, we are at this moment in America thinking about character and what causes a person to rise up and to be able to figure out a way to confront a crisis. I was so interested reporting this on these very profound questions. What is it in a person's nature that causes them to rise and think about the common good? How do you confront the fear when you see so much death? I mean, the hospital was hit with 1 patient, 2 patients, 3 patients, March the 3rd. By the end of that month, they had 2,500 patients through the hospital system. They had no equipment. They didn't have enough equipment. They had no masks. We have all lived seeing, years of the frontline workers behind these shields. But, what they were doing inside the hospitals, the mothers who were making hats for the people in the ICUs. This extraordinary doctor, Lindsay Leaf, at Weill Cornell, turned the entire hospital into an ICU with the other ICU directors. So all of it was, for me, a kind of just a reminder of the remarkable resilience of what it takes to survive a crisis.
Mm-hmm. Incredible. Marie
if
Brenner,
you think you know the story,
you got to read this book.
You got to see. But based on Marie's answer right there, there's so much more to the story.
That's right. Marie Brenner, thank you very much. We appreciate it.
Thank you. Thank you so much.